Hi, this is Asa, and welcome to my audio experience. Hi, it's Asa. I'm giving you a copy of my best-selling book for free to help you in your health journey today. I'll pay for the book. All you do is just cover the small shipping and handling costs. Go to asarx.com and get your free book today.
Insulin resistance, they're saying now could delay Alzheimer's. So insulin resistance, as you know, can be a way to delay or prevent Alzheimer's disease. They're saying in a new study, diabetes patients who take the drug metformin were less likely to develop dementia later in life compared to those on other anti-diabetic drugs, according to an analysis of Kaiser and their health system records. So pretty interesting stuff there. So, of course, the lower glycemic index foods that you can eat, carbohydrates, that just means that less blood sugar will be, or blood sugar will be managed a lot better, and less insulin will have to be produced. And, of course, so anyway, interesting. But insulin resistance in this, which is pretty interesting, the whole issue with metformin and how the anti-diabetic drugs are playing a role in this for folks that do have that. So it'll be interesting to see as time goes on with blood sugar-related issues like diabetes, how that correlates with Alzheimer's. And it's interesting. To me, I just find it fascinating. We're learning every single day. The research is just amazing at how the body changes. And the more nutrition that we're finding, in my opinion, that can affect the body, the better. Low T is a big deal, too. I want to talk about that just a tidbit. We get emails all the time about low testosterone. Testosterone is the primary male hormone that is so critical to function, makes us feel good, gives us our vitality. Women, you have it, too, and if your levels get low, then it makes you not a real happy camper either. So if your energy level's low and you're not interested in having sex, fatigue is becoming your middle name, and you're a single guy in your 20s, 30s, or 40s, it could be low testosterone or low T. The good news is a lot more single men have this problem than you might think, and something can be done about it. Yes, low T is a normal part of aging and fairly common in elderly men. The low T affects about 40% of men over age 45 and 50% of men over age 80. But young men can also be affected by low T, and more of them are going to the doctor to get checked out. With the recent advertising blitz on low testosterone, many of the young men are running right into the doctor with a chief complaint. And, of course, Dr. Sazusa is a physician at the University of Texas, says testosterone peaks at age 30 and then starts to decline gradually. That's exciting, isn't it? Explained Dr. D'Souza, if a young sexually active male has a sudden drop in testosterone, it can have a huge effect on sexuality and fertility. These men may be depressed, have low self-esteem, low libido, erectile dysfunction, and low sperm count. So what causes the low T in young men? Well, you need to look at a young man with low testosterone more carefully than an older man, and you may need to treat him more aggressively. Since age is not the cause, you need to look for common causes like obesity, drug abuse, or diabetes. You also need to look for less common causes like congenital abnormalities and tumors. So according to Urology Care Foundation, low T can be found in 40% of men with high cholesterol, 50% of men with diabetes, 50% of men with obesity, and 75% of men with chronic narcotic abuse. So it's really, really interesting how this whole thing plays off. So in the 2013 study in the Journal of Clinical Endocrinology shows how obesity can affect testosterone in very young men. And in this study, were taken for 50 young men aged 14 to 20. Half of the young men were obese and the other half had a healthy weight. So it's interesting. They say how to maintain a healthy testosterone level. This is what standard of care right now says. So here's some of the causes and what to do. Work off your belly fat. Obesity, especially the type that collects around your belly, is a big risk factor for low testosterone. It means losing the weight, maintaining a healthy weight, exercising regularly, and eating a healthy diet. Don't do drugs or abuse alcohol. So smoking marijuana is a common cause of low T in young men. It raises estrogen levels, just so you know. Not a good thing. Sleep well, too, because lack of sleep is a common cause of low T. Anything that interrupts sleep causes testosterone levels to fall. So part of the reason that testosterone is secreted in the bloodstream at night during sleep is because of having a good solid sleep. Sleep is key. Don't smoke either. And if smoking isn't bad enough already, it's evidence that smoking can contribute to the erectile dysfunction, lower your sperm count, and it can contribute to metabolic syndromes. Here's the bottom line. Low T in young men is more common than we once thought, and it's needed to be treated aggressively to restore sexual health and fertility in young men who are affected. So low testosterone can be a serious condition in any young man. If you have symptoms of low T, erectile dysfunction, lack of desire, increased body fat, decreased energy, loss of muscle mass, and depression, give your doctor a call to discuss options ranging from testosterone replacement therapy to creating a healthier lifestyle. And it comes down to healthy lifestyle. It really does. No matter what you deal with, no matter what you struggle with, having your lifestyle and get it maximized, that's going to be your overall key. Because if your eating habits are not right, you don't have good exercise habits, then the body's not going to be responding the way it needs to, and you're not going to be responding the way you need to. So getting the body compliant, get it balanced, is the key to really hit your goals with your health. Low testosterone, if you've got it, you want to know some natural ways to manage it. Here's some great little tips that we know research says. Weight training is a great way to raise testosterone levels. Just by weight training 20 minutes a day, 3 days a week, you can boost your testosterone almost 200 to 300%. That is a big, big deal. That's a natural way to boost testosterone levels, really. I mean, that's a huge deal. The next thing, too, is keeping your diet, having plenty of fat in your diet, about 30% of your diet in good, healthy fats. The healthy fats help raise testosterone levels in, of course, a natural way or natural manner, which can support it long term. And an easy way to do it, you can add just a couple handful of almonds to your diet, avocados, maybe eat an avocado every day, eat a couple of the egg yolks, maybe get a little bit of omega-3 oils. See, all that can be beneficial. You crank out 80, 90, 100 grams of fat a day in your diet, now you're talking. Now that's going to, and these are good fats, by the way, now you're going to get testosterone levels up and get those cranking so you can support healthy hormone levels. Such a key in looking at all these sorts of issues. Very, very important. Low T is such a big deal. 888-283-7272. That's the phone number. Check us out on the web, too. If you're looking for a wellness provider in your area, go to the same website. You can find all the information you need right there. Going to the phones to talk to Lauren. Hi, Lauren.
Hi, how are you?
Living well. What's going on?
I was just calling to inquire about if you had any advice for me. I'm 24 years old, and I've been suffering from migraines for about 7 or 8 years, I think. I don't remember having them as a kid, but when towards the end of high school and definitely in college and still today, I get them on a weekly basis. And I was just wondering if you had any suggestions for, ways to eat that can help with, like, head sensitivity or, something other than a prescription.
The headaches, when you get them, do they hurt on certain sides of the head?
It's usually either on the sides and, like, in my jaw and tension in there, or it can be, like, on the front of my forehead all the way across.
All the way across. Now, does it work around your cycle?
Yes, it used to, but now I'm on the pill, so I don't have much of a problem with that anymore.
Yeah, okay. What about anxiety? Have you had any history of dealing with anxiety at all?
No, I don't have a medical history with that.
Nothing? Okay. All right. How about grinding your teeth at night? Do you know anything?
I used to do that. I haven't. My dentist hasn't said anything about that in recent history, so I know that used to be part of it. I do see a chiropractor for some neck issues I have. I work in an office, and I'm on a computer all day, so I know that has something to do with it as far as the onset, but I didn't know if there was something, my doctor basically said, well, you're a migraine, or however you want to say it, and I'm like, well, there's a reason why my head is more sensitive than other people's, or I think there should be, so.
Sure, I understand. What about your eating habits? Are you a healthy eater or not so much?
Yeah, I'm a pretty healthy eater. I have a lot of spinach, avocado, fruits and vegetables in my diet. I don't eat out a lot. I don't eat fast food ever, really. So, yeah, I'm a pretty healthy eater overall.
Okay, plenty of proteins as well, like chicken, fish, eggs, that sort of thing?
Yeah, I have chicken and tuna on almost a daily basis, or egg whites, or actually hard-boiled eggs. I'll eat the whole thing.
Okay. Yeah, have you done blood work recently? Have you ever had your nutritional deficiencies looked at and see kind of an overall profile of your body? Have you done that much?
I have one time in college I was really anemic, and I had my blood work looked at. Everything was good except for my iron levels.
Oh, the iron levels were low. Have they been corrected? Do you know?
Yes.
Okay, good. Yeah, I would look at a couple things. Usually when you have headaches that come on like that, stress levels can bring those on. If they're around the cycle, you can get your hormones checked, of course. But look at things like acetylcholine. It's a brain chemical. When acetylcholine levels get low, then you start having headaches on a semi-regular basis. That can be an issue. And lecithin or phosphatidylcholine is a supplement. It's found in egg yolks, actually, and it can be very, very helpful. You might want to do some research on that. And also zinc levels and iron levels are pretty common with headaches on either side of the head. So when you get your blood work done, maybe you go to your doctor, ask them to look at ferritin levels as well as iron. Ferritin's kind of the storage tank for iron. If it's low, sometimes that could be the culprit. Thanks for the call.
Hi, it's Dr. Asa. I'm giving you a copy of my best-selling book for free to help you with your health journey today. I'll pay for the book. All you do is cover the small shipping and handling cost. Go to myfreehealthbook.com. That's myfreehealthbook.com. Yes, I'm giving you a copy of my best-selling book for free to help you live stronger, longer. Remember, I'll pay for the book. All you do is cover the small shipping and handling cost. Go to myfreehealthbook.com. That's myfreehealthbook.com and get your free book today.